Dear friends, welcome to Know Thyself YouTube Channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we spoke about the classification of hearing disorders. In this episode, we analyze the causes, diagnosis and treatment of hearing disorders. Causes of hearing disorders. Some of the conditions leading to hearing loss, thereby causing hearing disorders, include ear wax buildup in the ear, fluid buildup in the ear from an infection, an external object being stuck in the ear, abnormal growth of bones in the inner ear, damage to inner ear from repeated ear infections, a puncture in the eardrum, dysfunction of the inner ear, the cochlea or the auditory nerve, damage to the hair cells in the cochlea, exposure to loud environments and high-frequency sounds such as construction sites, fireworks, using headphones or concerts, pressure being underwater or in an airplane, side effects of certain medications, and aging. The growth of tumor in the inner ear can cause balance issues, dizziness, ringing, congestion, and brain damage, leading to hearing disorders. Inflammation of the protective membranes of the brain and spinal cord can lead to hearing disorders. Complications caused by highly contagious viruses can lead to hearing disorders. Diabetics and hypothyroidism can affect hearing loss, leading to specific types of hearing disorders. Similarly, Lyme disease, arthritis, and some types of cancers can cause hearing disorders. Traumatic head injuries can affect a person's ability to hear, causing hearing disorders. Genetics, birth defects, and infections passed on from mothers during pregnancy to babies can lead to hearing disorders. Thus, there are diverse conditions leading to partial or total hearing loss, thereby causing hearing disorders. Whatever may be the cause that leads to hearing loss associated with hearing disorders, they significantly impair the development of the affected persons, their everyday living, their social interactions, and the like. Hence, the need for diagnosis and treatment. Diagnosis of hearing disorders. When hearing loss occurs suddenly, causes disruptions in your daily life, and it does not improve over a period of time, hearing is better in one ear than the other, and you experience ringing in the ear pain, headaches, or numbness of the body accompanied by hearing loss, then it is time that you need to consult your medical doctor. Doctor may conduct a physical examination of both of your ears to find out if there is a blockage caused by a foreign object, a collapsed eardrum, an accumulation of earwax, an infection in the ear canal, an infection in the middle ear, a bulge present in the eardrum, a skin growth in the eardrum in the middle of the ear, fluid in the ear canal, and a hole in the eardrum. This physical analysis, accompanied by relevant questions by doctor, would give him an idea of the physical condition of your ears. If the doctor suspects that you have a hearing disorder, he will probably refer you to an ENT specialist or an audiologist who carry out further tests. He may do a tuning fork test to diagnose the quality of your hearing, to detect if there is a hearing disorder and where the problem is. He also may administer an audiometer test to determine at which point the sound is no longer detected by the person, so that the audiologist could detect where the ability of the patient to hear stops. Besides, he may do a bone oscillator test to gauge the functional quality of the nerve that carries the sound signals to the brain. He may also administer an acoustic reflex test to find out whether ear muscles respond to sound vibrations. Speech and word recognition test to measure the ability to listen to speech in normal and noisy environments. Tympanometry test to determine if there are abnormal movements in the eardrum caused by fluid buildup, air pressure, or a tear in the eardrum, and CT or MRI scan of the head to find out the presence of fluid or other tumor in the brain. In the light of these test results, the ENT specialist or the audiologist would be able to diagnose the hearing disorder a person is suffering from and propose a treatment plan specific to the condition of the given patient. Though we cannot prevent hearing disorders that occur from birth or due to illness and accidents, some preventive measures can be taken to reduce the risk of losing hearing ability, such as regulating the volume of television, radio, music players, and the like. Avoid using headphones, using earplugs or ear muffs in noisy work environment and leisure venues, and avoid using cotton swabs to clean the ear. However, if someone is suffering from a hearing disorder, he needs to be treated. Some types of hearing disorders can be treated at home. For instance, earwax buildup can be cleared with warm water using ear syringes or wax softeners. Though some objects in the ear can be removed at home, they may require seeing a healthcare professional using precise instruments. Likewise, specialists may be needed to provide treatments such as surgeries to repair the eardrum, bones in the inner ear, or to remove fluid to clear the eardrum. People who are suffering from partial hearing loss are given hearing aids to improve the quality of hearing, depending on the nature and condition of their hearing disorders. Hearing aids can be worn behind the ear, in the ear canal, completely in the ear canal, or in the ear bones. Similarly, to help hearing loss resulting from eardrum and middle ear dysfunction, thin electrode can be implanted into the cochlea, which can help patients to enjoy music, understand speech better, even with background noise, and even use their processors while swimming. Likewise, people suffering from hearing disorders can learn alternative communication systems such as sign language and lip reading, which can complement or even replace oral communication, thereby facilitate them to interact with people socially better. Thus, there are diverse ways to treat those who suffer from hearing disorders, thereby integrate themselves into regular living with others despite their disabilities. In the next episode, we will begin our analysis of central auditory processing disorder. Thank you for watching this video. Stay blessed until we see you again with another video.